Hello everyone. This is Dr. Duggan, primary care doc, trained in both family medicine and adolescent medicine. So our topic today deals with the human papilloma virus vaccine. So to start, what is human papilloma virus? What is HPV? So it is a sexually transmitted viral infection that can lead to several issues, namely different types of cancers such as head and neck, oral, as well as cervical, penile, anal cancers. And it can also cause genital warts. So, Doc, what's the good news? The good news is that there's a vaccine for that. Yes. In the United States, we have the Gardasil 9 vaccination that's available for patients. It's been approved to start at 9 years old, but most start at ages 11 to 12 years old. With that said, ideally, if patients start before 15 years old, they can receive the vaccination in 2 doses. Their first dose and then 6 to 12 months later. For those that start at the age of 15 or older, they receive 3 doses. Their first dose, and then 1 to 2 months later, the second dose, and then 6 months later, their third dose. Even if a dose is missed or not gotten on time as recommended by the schedule, they can still pick up where they left off to complete the entire series. Why is it important to start earlier with the Gardasil vaccine, the HPV vaccination? Well, for one, you want to capture patients before they've ever had sex or any sexual exposures, ideally. And also, you want to capture them before they've been exposed to HPV. That's when the vaccination works the best. What are some things that we watch out for in the doctor's office once this vaccination is received? There may be injection site reaction, tenderness, or pain, so they want to be careful with that arm for the next day or so. But then also we monitor patients for at least about 15 minutes to make sure there's no fainting or syncopal episode once they take the vaccination. Again, not a common thing, but it is something that we want you to be aware of and that we monitor for. So what does the HPV or Gardasil 9 vaccine not do? If one has already been exposed to HPV, it doesn't help with any diseases or any processes that may be going on post-exposure to HPV. It's not going to stop any of that. The other thing that studies have shown were that kids that have received the HPV vaccination, say 11 or 12-year-olds, it does not increase their risky sexual behavior. So that's a good thing. So the next time your primary doc or your pediatrician recommends this vaccination for your child or for a child that you know, I hope that you will take in consideration some of the pros in utilizing this vaccination. I hope this information has been helpful. Here in Health, Dr. Duggan. Bye.